Hey, it's Mindy here from Mike and Mindy in the Morning, and every year I'm so happy to be hosting and emceeing the Making Strides Against Breast Cancer Walk right here in Brevard County. It'll be my 17th year hosting the event, and Tepas Breast Center has been doing it for 4 years as one of our sponsors and bringing on a new sponsor, Imami Skin and Cosmetic Center, which is amazing. And Dr. Imami, welcome back.
Well, it's a pleasure being back, Mindy. so nice to see you.
Yeah, and I'm so glad that you guys are back as one of our sponsors. And if Tepas Breast Center, people don't know about it, it's the first comprehensive breast center right here in Brevard County.
Absolutely. I mean, we've been providing these services for over a decade now in Brevard County, specifically for women and their breast needs.
And what I love about your facility, it's not like you're walking into a clinical facility. It is such a welcoming place. You walk in, you feel like you're at a spa. So that, when people get the news about that, women get the news they have breast cancer, or they're going in for an exam, or they know they have to go back in, they want to feel comfortable. They don't want to have that sterile feeling when they walk into a doctor's office.
There's nothing sterile about our place,
yes,
as you know, since you've been there. Yeah, absolutely. It's a spa environment. We want to make you feel comfortable, relaxed. It should feel very nice.
And tell me about, we're talking about the genes. I have about 3 aunts that have breast cancer, and you say there's something completely new and out of the box.
Absolutely. So before it used to be if your mother had breast cancer or if your sister had breast cancer, we just intuitively knew that you were at higher risk for breast cancer.
Right.
And then over the past 10 years or so, the BRCA gene has emerged, and we realized that particular gene is linked to a much higher risk for breast cancer. But now we've come up with a panel of almost 20 other genes, that mark individuals as being at high risk for developing breast cancer. So that's, I think, that's one of the great advancements is that we can quantify your risk for developing breast cancer, and not just an academic exercise. Once we quantify it, we can lower your risk, with some medications.
And you guys have the ultrasound at Tepas Breast Center.
We have the digital mammography, we have ultrasound, we do breast biopsies, surgical consultations. We work tightly with our medical oncology colleagues, plastic surgery colleagues, radiation oncology colleagues to put together a comprehensive plan, including physical therapy, put a comprehensive plan together for all our patients.
So basically you do everything from the start all the way past that, and even further, because you go in for the surgery, you get the mammogram, you take care of everything, wellness inside and out.
Absolutely, yeah. We'll take care of the whole thing. We'll coordinate that patient's care, for life.
That's amazing. And then we're talking about plastic surgery, because I know women, they may hide it under their clothes, but when you have breast cancer and then you do have either a breast removed, that takes a lot on a woman, but you were talking about plastic surgery.
Yes. So, for women that, say, need a mastectomy, historically we've worked with, and we continue to work with plastic surgeons to provide that reconstruction. But historically, the cancer surgeon really wasn't concerned that much about the cosmetic piece. They would just, chop out the cancer.
Correct.
And then hand it over to the plastic surgeon. Now, we're much more aware and much more conscious about what we do. So we try to hide the scars. So we can hide the scars somewhere around the nipple or under the breast or up in the axilla. So a little more work on our part, but, it gives you a much better result. And for some women, we're actually able to save the nipple. So
Wow.
that's very important.
It is.
For many reasons. So some women are candidates for a nipple sparing procedure. So we're conscious about all of that.
And I was saying that Tepas Breast Center is also involved with various local groups.
Absolutely. So a whole host of support groups, including our own breast cancer support group. So whether it's for young survivors or middle age or whatever your category is, whatever you feel comfortable with, we can find you a cohort of breast cancer survivors that will provide you that support.
Yeah, let's talk about that, because it is Breast Cancer Awareness Month. When is the perfect time to get a mammogram? At what age? Because it keeps going up and down.
Yeah, it sort of keeps going up and down, but it's still for the most part, starting at age 40.
Okay.
Prior to that, you need to do self-exams, of course. When you're say 18 or 20, start self-exams. But then you work into exams by your physicians. And if you're at high risk, and again, high risk is if you're related to someone that has cancer, or if let's say you started having your periods early, or you wait late in life to have children, all of these things put you at higher risk. So you really need to see your physician to stratify that risk for you, because we can do, say, an MRI to pick up tiny little things that, say, a mammogram couldn't pick up.
Wow, that's great. So that's why I say Tepas Breast Center. Got to
We're-
come see you. Where are you guys located?
We're on 1140 Broadband Drive.
Yes, and you can
in
make
Melbourne.
it. You can go from Hibiscus on one side and
Nassau Boulevard on the
on the
other.
other
So
side.
I just tell people we're just 1 mile west of the airport on Nassau Boulevard.
Great. And then if you want to call to reserve your mammogram, all you have to do is call 321-312-4178. Now, we're not ignoring Dr. Stephanie Herodopoulos. I know you're sitting here very pretty sitting next to you, but we're talking about Imami Skin Cosmetic Center. I was very fortunate to do the grand opening, which was a huge success.
Thank you, Mindy. Thank you for
so
being
many
there.
people showed up. People wanted to see it, and I'm so glad that you ventured into that. Talk a little bit about that, and then Dr. Herodopoulos, we'll go right into your specialty there too.
So, we launched the Imami Skin and Cosmetic Center this year. I've been doing cosmetics for many, many years, but in earnest, now we provide surgical, but also non-surgical solutions to keep people looking and feeling young. So, whether it's Botox or fillers or whatever it may be, we have body sculpting, fat melting, all sorts of, rejuvenation tools to make people look young and feel young with little to no downtime.
Yes, which I love. I got a chance to sample a couple of your girls over there, and it was amazing. So one thing that's great about Dr. Stephanie Herodopoulos, you were one of the chair people for quite a few years for the Making Strides Against Breast Cancer Walk.
Yep, in 2011, and we had 10,000 walkers that day. And so I expect next week to be even better when we have the walk this year. But it was an honor to serve the American Cancer Society and bringing the community together for such an amazing cause and increasing the awareness of such a horrible disease that affects so many of our neighbors and friends.
Since you've joined Imami, and so tell me a little bit about what you're doing over there, because it was like your grand opening too.
Well, yes, I joined a couple months ago, but I've been practicing here in Brevard for 15 years.
Yeah.
I am a primary care doctor, which means I holistically look at the patients from top to bottom. I am a primary care doctor that will take care of men and women. But we're talking about Breast Cancer Month. So
Right.
women's health, it's not just about, of course, breast cancer. It's overall women's health. So what's wonderful about Tepas Healthcare is that not only are you a comprehensive breast cancer center, but you can come and see a primary who's going to take care of all your needs, both medical needs and aesthetic needs.
And talk about one of the specialties that you do over there.
Specifically, vaginal rejuvenation is an innovative approach to help women who have problems with, a lot of women who have breast cancer have problems with painful intercourse or urinary incontinence or problems with dryness and laxity. But you don't have to be a breast cancer patient to be a candidate for this. So women who can't take hormones, like breast cancer survivors, sometimes feel there's nothing they can do for this problem, which is a huge quality of life issue. So now at Tepas Healthcare, we have a CO2 laser vaginal rejuvenation. It's
wow.
FDA approved,
Right.
non-surgical. It only takes 10 minutes and it's painless. It's such a wonderful new innovative technique that we have there that really women should check out if they're having any of these issues.
And the results are incredible. I mean, do you have your patients come back and say, I wish I've done this long or sooner?
Yes, and there's no downtime. So you can literally come on your lunch break. It's just once a month for 3 months, and it makes a huge difference in women's lives. And in the fact that we offer that, I'm proud to have this in the facility and be able to help women in those needs.
That's amazing. Technology has gone so far and so quick. 10 minutes. That's it. Takes 10 minutes.
10 minutes, yeah. Non-painful is the key.
Yeah, that too. And also, why don't you talk about I know you talk about hormone replacements, and being a cancer survivor, you actually can't take hormone replacement.
Yes, that's correct.
Okay.
And traditionally, that's how you would treat women who had a vaginal dryness. But with that though, then you're putting it in your body all over. And this
Right.
way you just target the specific area for the problem that is at hand. Some women who have not had breast cancer, who might have some urinary issues, this actually can correct that. When you cough and sneeze, you don't lose a little bit of urine, or you can actually go jog and go to the gym and not worry about that.
Right, you're right.
So this is well worth it, and we are offering free consultations
Oh, wow.
at our practice to see if you're a candidate for it.
Oh, that's great. So for a free consultation, call 321-312-4198. And I'm glad you guys stopped over here because I learned so much in just a few minutes about breast cancer survivors, how to prevent it, meeting you guys and learning a little bit more about Tepas Breast Center and Imami Hair and Imami Skin and Cosmetic Center. So thank you guys for coming out. I appreciate it.
And thank you for having us.
And we'll see you at the walk on October 28th.
Absolutely, Mindy. Thank you for everything. And again, it's such a pleasure to have Stephanie
Yes.
Herodopoulos join us. So thank you both. So